Now let's look at how identification and treatment of multiple risk factors can be used to address the burden of non-communicable diseases. This is strategy number 2, multiple risk factor interventions. The identification and evaluation of risk factors is fundamental to the work in public health. We have evidence-based recommendations to address these risk factors. These are based on research and on a lot of cohort studies that we'll look at later on. Risk factors ranging from high levels of blood pressure and LDL cholesterol to multiple sexual partners and anal intercourse help us identify groups that are more likely to develop a disease. Evidence-based recommendations often focus on addressing risk factors, and implementation efforts often address the best ways to target high-risk groups. Thus, identifying and reducing risk factors is an inherent part of the population health approach to non-communicable diseases. When we speak of risk factors, we need to understand that a risk factor is a characteristic of an individual or an exposure that increases their probability of developing a disease. It does not imply that a contributory cause has been established. So just because I have certain risk factors for developing a disease does not mean that I will absolutely positively develop the disease. However, it is a flag that might call me to action in terms of practicing good health behaviors. On the other side of a risk factor is a protective factor. This is a factor that is associated with reduced risk of disease. Exercise is a good example of a protective factor. It reduces a person's risk of heart disease, diabetes, and a lot of cancers. Multiple risk factor reduction is a special form of intervention aimed at intervening simultaneously in a series of risk factors, all of which contribute to a particular outcome, such as cardiovascular disease or lung cancer. Multiple risk factor reduction is most effective when there are constellations or groups of risk factors that cluster together in definable groups of people. It may be also useful when the presence of 2 or more risk factors increases the risk more than would be expected by adding together the impact of each risk factor. Multiple risk factor reduction strategies are being attempted for a large range of diseases, from asthma to diabetes. In the following videos, we will look at the Framingham Heart Study, a cohort study that led to the identification of the cardiovascular risk factors. And then we'll look at the cardiovascular disease risk factor profile presented by the American Heart Association.